Hi, everybody. We're glad to welcome you at our second live session. And today we're going to discuss the hot topic about virtual surgical planning. There is a strong belief that the application of quality software and mixed virtual reality technologies improves surgery training and practice. Innovation in computer-assisted surgery aims to increase precision and safety by reducing procedure-related complications. And this live session today is part of the project that we are working here at Inobitec. And today we will have the privilege of being accompanied by a great professional, assistant professor of neurosurgery, Alex Andruska. He has a great hands-on experience, which he is ready to share today. So, Alex, hello, first of all, and can you please tell us, does virtual planning really improve clinical outcomes and the patient's quality of living?
Thank you, Igor, for the introduction. Really, the last trends of neurosurgery is really to improve the quality of life of patients. And by that, I mean trying to use everything that is in your hands, including technology, including virtual reality, including augmented reality, just to make the surgery easier, to make it faster, but at the same time to leave the patient happy and with less complications.
Yeah, I absolutely agree, because the focus is the patient all the time, and the things that we're enhancing all those procedures to prepare for surgical training. It's really perfect. I would kindly ask you to perform to show a couple of demo cases, if it is possible, on how you prepare, how you use the software to prepare for these operations. And before we start, I would like to say a couple of words about the program we will use today for demonstration. So it is Inobitec DICOM Viewer Pro, and it's a multi-platform medical software which is designed for advanced medical diagnostics and image processing for the quality treatment planning. And there is a wide range of extended tools, among which is 3D reconstruction and segmentation. Today you will be able to find the link to the program trial in the chat. So my team will introduce the link to download the trial and test the program. It is important to mention that it has multi-platform support, so it is good to use on. It runs perfectly on Windows, MacOS, and even Linux. And the license model is perpetual. So, Alex, can you please start your demonstration and show us some skills on how you prepare for the surgeries, and how do you use the program and the models in your virtual reality?
Sure, thanks. So while I put the sharing the screen, I'll say a bit about myself. So I'm currently working at the Institute of Neurology and Neurosurgery, Diomid German from Republic of Moldova, working as a neurosurgeon and also as a heavy tech guy. I love technology, and I was thinking, why not using advanced software, advanced tools, just to in our daily basis, in our daily work that we're doing. So without further ado, I'll just show a few cases. I'll share some interesting patients that we've dealt in our neurosurgical department. The first one is a patient with a tumor. It's a 18-year-old patient guy with a huge tumor, as you can see here on the contrast MRI, in his left hemisphere, which invades the entire anterior cranial fossa. It goes down to orbital orbita, nasopharynx, and it's causes a lot of swelling, brain swelling, and yes. So why this is important? This is a young patient, and okay, by that I mean it's not the age that is important, but we must be very careful because these patients are very young. They have a lot of reserves, and they need the special care after that. So it turns out of the surgery, after the tumor was removed, that it was actually a fungus in a patient with immunodeficiency. So I'll get straight to the segmentation. Here we have a lot of tools that you're usually using. I'll not go one by one because it will take a lot of time. The most important and most used is our segmentation panel, which you can see here. Here we can manipulate all the structures that we are interested in. In this case, we want to make to segment this tumor. We have the advantage of this software compared to others that I tried. It has the semi-automatic and automatic segmentation, which other softwares they struggles at time to differentiate between structures, even despite their the brain has different intensity as the tumor. So I'll just show you how I'll create a fast segmentation of a tumor. We have here to make a segmentation based on the intensity of the tumor. Here we obviously need a high intensity one. As you can see, we have an overlay of the mask on top of this imaging, and with the help of the adjusting window, we can directly adjust how much intensity do you want to put in our structure. So in this case, it's around like this. Then after we put the mask, we need to segment, make the segmentation on top of that mask. We have some instruments here for manual and automatic segmentation. So we have, for example, this one, which is segmentation from point to mask, which actually makes the entire segmentation of all the mask. It's better to use this when the tumor is inside around low intensity structures, because as you can see here, the tumor also is interconnected with other high intensity structures. So it segments everything. So in this case, we can use another tool, which is region growing, and we can grow the segmentation from one point and extend it in the direction as we need, for example, like this. And I'll do it roughly, so I'll not take much of your time. After that, obviously sometimes, because like I said, I picked up a pretty complex image, sometimes the software doesn't differentiate, and any other software doesn't differentiate a tumor on such intensity as the skin. So in this case, we have manual tools to make that changes, to remove the parts that we don't need or the parts that we need. Some parts that we must include and others that we don't. So in this case, we also had the questions, what about the vessels? What should we do about them? That's why I will show you now the CT angio. We also made the CT angio to see the correlation of this tumor to vessels. And here comes in help a very useful tool, besides all of these that are very interesting. I'll just name them just so you can know what it can do. The volume reconstruction, I'll show you a lot more of this on the next case. This is the NPR, the mainly what I use. This is for vessel reconstructions analysis, for heart, endoscopy, and this is the series fusion, which I haven't seen any software that can fuse imaging studies such fast and accurate, and by not manually trying to pick points and to fuse them together. So we'll now add here our MRI on top of this. We'll just pick our MRI contrast. It goes together with the segmentation of the tumor we made, and just I'll drop here. At first it's a bit messy, but it's not a problem because we didn't fuse them yet. So now we have a panel for the fusion. We can pick out the contrast, and here we can just press A and it will automatically fuse based on the gradient correlation of these structures. So now we can, like I said, I'll use this. We can already see it in 3D. We can turn down the samurai because we have only the segmented, we have only the tumor. I'll name it tumor so you can see. And here we can play with a window. We also can remove this table from the patient's head. And we can play with the contrast by sliding the mouse by using the window level. Here, let's put a mesh around the tumor. And here you can see the bone, the vessels, and also the tumor. We can also make some cuts, some little cuts on different planes, so you can see inside of it. And we can also adjust the transparency of this segmentation, so you can see how much impact had this tumor and how it irradiated the bone around it and its correlation with all the structure in the vicinity. So this is basically the general image, the general workflow, like how we start from just 2D slices and we're going to 3D complex images. And some softwares, they stop as Slicer or Radiant or even Osirix, they stop at this point where you can't do anymore, just besides some cutting and without manipulating the structures by doing different colors or segmenting by automatic region group. So for this, I will get straight to the second case. I'll close this up. So the second case is a patient with seizures. It's a young 45 years old patient with that undergone an MRI contrast, and we can see that he has something bad. In this case, as we know, this is obviously some kind of malformation, and we also did an angio-CT. So we'll not need here MRI so much, but we are interested in the angio-CT. So I'll adjust here again, remove the table. I'll change the window with mouse slide, and I'll just show you how it looks directly on the 3D screen. And here is the main problem. So as you can see, and when we try to see directly on 3D, we have a lot of vessels that are stick to the bone, these are usually the dural veins, the superior sagittal sinus in this case, and even the malformation is stick there, and it's hard to understand what are the vessels around it, what is feeding it, what is draining this malformation, and how it's related to other healthy vessels. Even if we can rotate this, we can't see, we don't have so much information to understand all the orientation or how you will approach this surgically. I'm not talking about endovascular because it's another model. So here I can show you where the magic happens. We'll go to the NPR. And what we need actually in this to have all the vessels separately, we just need to remove the bone. So in this case, we can take the contrast CT and fuse it with a native one, and going into NPR. And we have, after fusion, we have here in the segmentation panel, we have the option to remove a bone. And it asks, it will make a new series with bones subtracted. It takes a few seconds. It's identifying the bones. And now we can go back to our, and we have here the bone subtracted here in 3D. Let me put it directly in 3D. And here we have same 3D image, but without the bone. We can adjust the window depending on how much information we need from it, what vessels do you want here to remove or to let it stay here. We also remove the table, remove all we have the option to remove all the unnecessary artifacts around it. And here we have a malformation. For some, and we don't stop here, for some of us, it's pretty clear where it's the arteries, where are the arteries, the feeding arteries, what are the draining veins, where the nidus in the it's going, where it's starting or when it's finishing, and how deep it is. But we can go even further. We can go and create 3 segments. For example, in this case, we need to see the nidus, the malformation itself. We need to see the arteries, and we need to see the veins. So for that, we create 3 high-intensity structures, and we just have the ability to copy the segmented structures. And here, this will be the nidus, this will be arteries, and this will be veins. And here we have an awesome tool that I use very, very often. We can show the software where approximately we want to start segmenting automatic segmentation of these structures. Yeah. So we start, for example, we don't need to put exactly where it is. We know for sure as neurosurgeons that these are arterial structures. This is our anterior cerebral arteries, which is azygos type. We know this is artery, this is middle cerebral artery, this is artery, and this is artery, and we can stop here. For veins, superior sagittal sinus, this is a vein, Sylvian vein, this is a sigmoid sinus, and I think it's pretty enough. This is also a vein, enlarged vein. This is some kind of Rollinic vein that is draining mainly this malformation. Yeah. And here now we just choose here. We have the tool that I like very much is the watershed segmentation, that I said that it picks the starts of a segmentation based on these points and extends them where they meet together, depending on the intensity obviously. And here it is. You can see here we have some little artifacts like that. We can easily remove them. Yes, and the nidus. Oh, I forgot to put some points on the nidus. And segmentation again. So here you are. Now you can see clearly where the artery starts, where it goes, and where it ends inside this malformation. So now, when you are approaching this malformation surgically, we know for sure where this artery ends, where it have branches that could potentially feed some important health areas and avoid injury to other structures. So sometimes it happens. In this case, it's pretty perfect, except for example, this little branch, because of some point that extended to here, we can manually make it segmented by bringing back the base volume, removing the veins, and we can pick here the region grow instrument that I showed earlier in the first case, and just pressing by clicking and dragging across the artery. So you need to choose artery and drag it across the artery. So you can see it fills up the artery as it goes and reaching the malformation. So now you can sure understand now where the malformation it's feeding from and how it's confirmed against the other healthy vessels across. And
it looks like the blood is running, right?
Yeah, it's really you can look also how it's the blood is flowing. Sometimes it's just fascinating just by removing the arteries. Sometimes I do it, and I'm curious how, let's say it like how it will flow on the arteries. Now I can show it because I already drawn everything, but I think you understood. So now comes the virtual planning one. So why virtual planning? Despite having a very nice model in 3D, for example, this one, you watch this imaging for the patient on a 2D screen. You have a 3D model, you can go around it how you like. You can analyze it, you can try to pick everything up, but anyway, when you put it in VR and you see this model in your hands, you have a different approach. We had some stories in our clinic where a neurosurgeon he chose an approach for tumor, which was very deep, and there's too many discussions about how you will approach that tumor. And we made a decision, but I decided actually to bring the VR headset, to bring it to work. And I said to him, just try seeing this model in virtual reality. After he put that headset, he changed his mind, he changed his approach, and he said that it's really when you take that headset and you try to see that model in 3D, it completely switches your way of thinking and how do you approach a pathological process. So now let's get back to our model. I'll show you how you can see it in VR. Obviously, you'll see now in VR on your 2D screens, but you'll approximately see how it may look. And despite, I know because of this COVID, it's hard to make some big conference and to bring people up to show you how, but maybe in the future it will be possible. We have here the options to export all these structures into Windows and on different formats, STL, FLI, and other 3D format objects. And you can import them in any other software for modeling, for sculpting, or they are very easy to use and they're very fast because Inobitec creates relatively low polygonal meshes. So it's nice to use. For the sake of time, anyway, I already uploaded this model with the bone also. The bone I already showed in the previous case how the bone is easily segmented. So I already put it in a 3D software. This is a Blender, free open source. It easily opened up in Blender without a problem. It's uploading instantly. And here you can see this model with the bone, the needles, the veins, the arteries, and we'll now switch. Igor, can you switch now to VR, right?
Yeah, sure.
Yeah.
Off you go.
So I'll share here my second screen, which is prepared for VR. Okay.
Can you please tell me if there's any possibility to watch at the same model simultaneously for several people in VR?
Yes. For that, you need a different software, not Blender, because Blender doesn't have yet the plugin to see it in
multiplayer mode.
In
right?
multiplayer, there are some other softwares, but I'm trying it to make it in Unity, but it's still difficult and it requires a lot of people. And maybe Inobitec will make it in the future possible because it's hard for me, but easier for a big company. So anyway, we'll switch now to VR. I'll share my second screen.
Yeah, actually, we're right now we're working on virtual reality, and probably soon we will introduce something interesting to you.
Okay, so I'll move my microphone a bit from my way so I don't knock it out. Okay, so I'll zoom out because I'm too close to the bone, to my model. So as you can see here, we have a structure, right? And this is, it's hard to grasp how it may look in on 2D screens of a VR environment, but I think you must try it and you'll understand why I'm talking about, and I'll try to show some little details that are very, very picky when you're shooting them in VR. So this in these softwares, we have a lot of instruments that you can use. I'll not go back to all of them because there are too many and we don't have so much time for this presentation. We can use here a lot of learning tools, a lot of tools to help neurosurgeons pick a nice approach. In our case, to pick a neurosurgical approach, the best approach, so to minimize complications. And also to teach younger ones, to teach students anatomy, new approaches, or to facilitate or to improve our learned already skills for the senior ones even. So now I'm looking down and I can put the head of a patient, I can make it smaller and put it like I'm doing it in the during the surgery. And I can easily understand how far it's from the craniometric points from the nose, how far it's from the midline, how far it's from zygomatic process upwards, and where we should make the bore holes. Actually, we don't have yet in this software to make all the bore holes, and I remove this this bone, I remove it in Inobitec, because in Blender it requires different tools and it's harder to make it. But maybe in the future they will make it, or any other software. So yeah, so like I said, we have some tools. We can have some drawing tools that we can use and say that this is the AVM, for example, right? AVM. So this is the AVM. And like you said, Egor, maybe in the future when there will be a lot of people around, you can create an environment where you can show this model, explain different aspects of these surgeries or the anatomy for the students, and not necessarily together, but at home from different places from the earth together in a VR environment. So yeah, we can make it smaller to see the patient's head, like how it will be in reality, and put it down like it's fixated in the Mayfield during surgery. We can also make it big enough so we can go inside of it, like we're surfing around. We can see all the arteries. We can see this is the middle cerebral artery. We can go further. We can go under the malformation, like like an alpinist is trying to go over a mountain. So it seems funny, but it's very, very enjoyable. And after that, when you will go in surgery, it's very easy to remember all the structures that you have seen in VR compared just to seeing them on 2D screens on imaging, or even on 3D models on imaging. So,
and at the same time, I guess you're able to use it in the theater. I mean, in front of the operation table, so you can just look at it.
Yes.
Become well prepared. If you can potentially share the demonstration with the other colleagues, you can discuss it, and then you go straight at work.
Yeah, what's nice that after exporting this from Inobitec, you can upload them pretty easily on the mobile devices, share them in 3D with other neurosurgeons, even they don't have a headset, but at least they can see the model in 3D. And obviously you can use them in augmented reality. I didn't have the chance yet to try these models on augmented reality, but I used it on experimental software, which I'll show you some interesting videos at the end of the presentation. But now if you go back, what I want also to share, it's, yes, besides these tools, another interesting tools that we have used in our department is the sculpting. We have the sculpting tool, which allows us to remove some models. For this, I'll need to choose the arteries, or is better veins in this case, because it's on top. So here we can choose sculpting, grab brushes, grab, and then I pick my favorite one, which is called elastic deform. And here we can play with the veins like during surgery, putting veins apart, taking them out of the way and seeing what stands behind them, and how you'll do it during the surgery, how you'll move the veins during the surgery. It's not perfect. It's at least it's a free source, so it's not perfect, but it's still improving and very nicely improving. And we'll already used it, especially in cases of aneurysm, where we remove this clinoid or this smaller ring of sphenoid bone to clipate an aneurysm at the base of the skull What I also wanted to share is, like you remember in the first case, at the start of the second case, I said about the veins that are sitting here, sticked to the bone, to the inside lining of the bone. So this that helped me in the bone subtraction is that we can use the bone subtraction to leave all these bones. Sometimes, sorry, 1 second.
Yeah, we have another listener from the stream listener from your side, right? The pet is coming.
Yeah. Okay, so what I want to say is that when we I tried this removing in Osirix, I think, and Radiant is not possible, and Slicer, yes. So when you remove the bone, it removes with half of the veins that are sitting here. And sometimes you have an important vein that sometimes it goes inside the bone, so like diploic or emissary veins, that after cutting them in our software, they cut entirely with this vein. So when you go into surgery, you'll get a big surprise, because you also removed that vein when you try to segment this. But with the help of bone subtraction, which I haven't seen in other software, it made it perfectly. So sometimes you can even see big diploic veins getting out of the bone. So it's very nice.
Alex, would you mind? I think I shall check the chat. Is there anybody live there?
Sure, I'll keep this model here.
Yeah, and we can go to the Q&A session, and yeah, we have a couple of questions here, if you don't mind.
Yeah, sure.
Okay, so the guy from the guy with the nickname, yeah, the person with the nickname Biomodel is asking, how can I obtain the volume of an organ and then extract a defined percentage of that volume? For example, extract 20% of that organ volume. Have you ever
I understand.
tried?
I think this is a question, I think, regarding the hepatectomies, when you remove a specific percentage of the liver so you can leave a patient alive with the rest of the liver. I think this is possible when you, in Inobitec, when you have a region growth and we are clicking a segment, for example, let's say the liver, right? So you segment the entire liver, put a mask on it, and when you segment manually, you can see in the segmentation plane, you can see how much volume this segmentation picked you. So you just semi-automatically, or by dragging your mouse, you can make it more, and you can livelessly in live, I mean, to see how much percentage or how much volume from that mask you segmented. So you can do that.
Can you please can I ask you to get back to the Inobitec program window, because we also have a couple of questions regarding the Inobitec software.
Sure.
So you can probably demonstrate something.
So I'll share you my main screen now. Okay. So yeah. So here, for example, you can see in the right. So I think I can show this if I'll put the MRI. I'll put here the MRI, for example, this tumor. So here you can see the volume of this tumor, right? So you don't have here the percentage, but let's say you need only 40 centimeters cubes of this tumor, right? So in this case, you can create a same copy, or it's easier to make a same intensity structures with the same mask, and you can limit your segmentation on this yellow, but you can leave it like this. And you just pick the region group, and you can see in the right plane, in the segmentation plane, you can see how much you segmented. So you just go by your liver, or I don't know which organ you need a percentage from, but I think it's he's talking about the liver, and you can segment it and see how much you picked up. So you just make it more till you need your full percentage, or
that's a very nice way. That's a very nice way to control the volume of the structure which you need to be exported.
Or you can do it vice versa. You take the already segmented one and you remove, and now you remove manually, or you remove by cutting, and you'll also see how much you cut and how much left from this tumor. You can play around with it.
Yeah, another question. Ivan Matukin, he's asking, hello, do you use undo button? How I can fast reset all manipulations or transformations in the program? Or I need only reopen the file to reset?
To reset the manipulation, Control-Z or undo button. Here you have. Or you can, like many of us do, you can save a project. For example, you think you have done a nice segmentation. You just can save it in different files, this project. So if your undone button has too many steps and you have done too many mistakes, or I don't know, you just go back to the project where you stopped at, where you liked.
I suppose in the next version releases, we will add automatic saving the segmentation results to the file. Yeah, it will be available in the extended segmentation module, so you will have a chance to get back to the previous states easily. And in case you have any power cut, and in order not to lose all the work you've been done before, it will be very useful for the users. Mm-hmm. Another question from Pietro Kamenish. It would be possible to do the same, but with augmented reality during the operation.
Yes, it is very possible. You just need VR glasses, AR glasses, and the AR glasses have inbuilt software that you can just upload. You can, for example, here, you can export this model in different formats, and the AR software that is inbuilt, where you can download them in VR headset. They have free, and they also have license softwares that you can upload these models, and you can apply them on the patients during surgery. There are some studies now that are trying to make it happen, and it's very possible, and it's not so hard. You just need to have a headset, and that's all. And this software, obviously, to segment this perfectly.
As far as I know, Alex, you already have an experience using augmented reality in the operating room. Can you at the end of this session, if we have some time, can you please show us some cases?
Sure, with
Yeah.
pleasure.
So, as if I would like to move on and save time and answer more questions because we have some of them in the chat already. What Blender add-on do you use to connect Blender to VR? Do you use Oculus Quest with link cable?
So I'm using the cable only for so the battery doesn't go out pretty fast. But I'm using Wi-Fi through Airlink, and in Blender we have a plugin for that. It's a free plugin. It's called Meowie plugin. You'll not find it here in the add-ons, but you'll find it on internet. I think it's called something with Meowie plugin, or just type in Google Blender
VR
Meowie
plugin.
plugin.
Yeah, okay.
Yeah. So
any another question from Vivek Gupta. Any advantage over D2P from 3D systems? Have you ever had any experience working in D2P?
D2P, no, I don't have experience with D2P.
As far as I remember, the discussion with the users from different countries, which we already have, and who also have the experience working with different softwares. I suppose first advantage was to the the speed of work, the automatic result. As you can see, it works in some case on some cases as quick as a flash, and intuitive interface allows you to master the program in quite a reduced amount of time, which is quite important. Another question from Tiago in the chat. Does the segmentation use AI? No, we do not use any AI. It is a pure mathematical algorithm, voxel rendering, which allow to, and different like watershed algorithms, which works with the intensity levels. Okay.
Yes, AI, I tried it, to be honest, I tried using an AI in Slicer, for example. As far as I know, it has some module, experimental module, but it's you'll not find now any perfect, especially some big companies, I will not say the name now, but they're very expensive, that have using an AI for segmentation, because it's very roughly. Maybe they can segment a big, a high intensity tumor inside the brain and not touching anything with same intensity around it. That's where AI can segment it pretty easily. But for example, in these cases, AI now will do nothing. It will just make everything white, or depending what color on it. I mean, it will segment everything.
You always need to have control in your hands to for the complex cases. I'm not sure that currently you can trust AI 100% in every case.
Yeah, in small cases, yes, for sure. But it's
Yeah, just getting back to the question asked by Vivek Gupta about the difference, about the comparison with D2P. You can always, I shall remind you that you can always go at Inobitec.com, and if you have any experience with other software, you can easily download our software, Inobitec software, at our website. It is open for downloading, and it is free for 30 days. So you can test it and you can make your own conclusion. What is different? But the differences which are on the surface, which are lying on the surface, is that we have perpetual license for the product, and we have a lot of automatic tools which allow us to get the desired result in a reduced amount of time. That's it. Um, uh, when I was watching you rotating the model in VR, I thought about DTI cases, for example, which are colorful and very picturesque, and they can be. I've just had an idea of looking the DTI cases in VR. Do you have any examples which you can share with us?
Yeah, I think I have on here, which I already have seen the previous weeks. Let me see here. I'll share my screen. Okay. Yeah. So we have here, this is not one of my cases, but this is a case that I picked up so I can see how nicely it can be, you can make it. You can see the fibers, the tracts. So this is a patient with multiple brain tumors. Here you can see the whitish one, right? It's in the ventricular system. It may be some infiltrative, I'm not quite sure. But here we have option already saved. I have this project saved, which where you can, here you can have a DTI and just apply the DTI on top of this MRI contrast. Here you have all the slides with the DTI. Here we have, it is already cut because it's a saved project. Let me bring it back. I'll just upload it from my already done here. Here, you can see here, right?
Yep.
So here you can see very nice fibers, very nice colors, and it works pretty smoothly. And here you can see the tumor. It's already segmented. So you can directly already see this in 3D. You have here 3D, make it bigger. And here you have all the fibers. You can see all the fibers that from tectography. But what we need usually in these cases, why you're doing DTI in such tumors, is because it goes near important structures. In this case is the coronary radiator, or the tracts that responds for movement. So the corticospinal tract. So for that, we can easily, so we don't get messed around with this arcuate, with this posterior and all associative areas. We just can go back down to the brainstem here. And we can make a new one to say to the software, okay, I need only this one. Okay, so on this, 1 second, this is the saved one. Okay. Let me bring it up from the saved project. It pays on top of that. It puts another slice or another layer of entire. Here we can say project, and here we have the group that we segmented. Here that I segmented. It was putting another. I already pressed this, and it put another overlay with same DTI. And now we can watch this in 3D. We can remove the base model. And here we can see already much clearer how it correlates, how the tumor correlates. This is the coronary radiata, which goes from the cerebral peduncle, goes down and down to the body. So here you can see how it correlates. So it's pushing them forwards. It doesn't touch them. We can also see this in VR. We have some times to show this in VR.
Yeah, we can do this.
Yeah. So in VR, to see, for example, these fibers in VR, you have here the options to create a mesh, and you can pick up how dense you need for mesh. You can pick depending on how each tract, how much vertices it will have. Usually 3 is enough, and how much diameter. I use 0.2 usually. And here you can see how it puts an entire mesh on each fiber. And from where you can just export it here. You can export by using.
Just make a small pause here, a small break here, because we have another question in the chat.
Yeah, meanwhile, whether we can
export the files as STL. Just please repeat which type of format export we support. Thank you.
How I said it, you can export this. Here you have the option to export this mesh, and here you can export it in 3 formats at this time. So you can host in poly, in STL, and object. Poly if you need the colors, STL if you don't need the colors. I like usually STL because I draw the colors in other softwares. But in this case, for example, if we want to leave these colors of the fibers, we can leave the PLI. And I'll just, if I have time, right? I have some time?
Yes. Yeah, so sure. Off you go.
I'll just switch to another screen. I'll upload this model in VR in Blender. Let me see here. I'll share my second screen. Here, my second screen. Currently it is black. Don't panic. It will go soon here like this. And I can now put my headset on. It's going in standby mode. That's why it's white. It's black. Okay. So now we have here, I also can see my screen in VR.
Yep.
And here we have the option and window to new VR window. So we're bringing this again, zooming out. And here we have this model, beautiful, colored with all the vertex colors in VR.
Very nice.
Yeah, you can see the tumor.
That looks.
And now you can also see. I can challenge you to try to do this on 2D screen. Yes, it is possible, but it's more enjoyable and more mesmerizing when you see this in VR. And you also can just pick, for example, measure.
It's just like being inside. Of this.
Yeah. So you can measure it 2 centimeters. You can see also how much distance from different fibers. You can play with it how you want. So it's not a problem at all. And it's very nice.
Great.
See, here you can see.
Great. We have another question from the chat from the user. I don't actually know how to pronounce the name. Sorry for that. Biojape. Okay. So could it be possible to have the Inobitec software DTI reconstruction on other regions like for brachial plexus recon? Sorry if I pronounce it wrong. Do you know what's brachial plexus recon?
I think he means the brachial plexus. This is the structures in the arm. So sometimes you do on patients with brachial palsy, you do a tractography to see how it's interrupted or where the lesion is. I think you can do at any level because it's same imaging and you are putting the same DTI function and you can use it without a problem. It doesn't matter a nerve or an entire brain.
Yeah, it's just important to have the DTI series inside the study. That's it.
Yeah. Not only the images, because some centers, imaging centers, they put only the screenshots or they put some 5 slides on different levels, but this is not enough. You need to have entire set of DTI. We are unprocessed raw DTI, so you can apply them and model how do you want them export or what we want to do.
Okay, so feel free to ask any other questions, and as soon as we have a little time left, I would kindly ask you, Alex, to show some of your AR experience. Can you
Yeah,
please share with the audience? And
sure,
I'm
sure.
also gladly look at it.
Yeah.
Thanks a lot.
So let me share again my screen. So here I have my second screen. I have this presentation from the Neurosurgical Society, but I removed the slides and left only the AR videos. So, like I said, these models we don't have yet. I don't have yet augmented reality headset, but I tried it by using just my iPhone and an app. And here you can see I tried it, experimentally exported the model from Inobitec, and it nicely applies in the augmented reality. Here I tried just on the wall. Here I tried on some phantom, how it looks like. Then after that, I got further and I tried it on one of my colleagues. Obviously, he was moving. He was not able to stay in place because his head is not fixated in the Mayfield, but you can manipulate it with it in the air. So it exactly stays at the same place we're in. After that, I use it in the patients. Same models, all the structures are made in Inobitec. So I put it on the LS overlay of a patient's head, and where you can nicely see how you approach some of tumors. Here is interesting. As you can see there behind the finger, the blue one. This was done using neural navigation, and we also tried to see how it will the augmented reality model with overlaying it. So bear in mind that this model is staying in air, is anchoring from the floor. So considering that, this is very, very accurate. I'll use it in future. I'll use some anchoring points like QR codes, like you put near the patients, when you can make more accurate precision of or placement of this model, of this segmented model. And here's a few more examples. This is the same patient with two tumors, and you can have an approach. You can make an approach to remove both tumors at the same time from the same approach, same trajectory. And this is a patient with hydrocephalus, where you put a shunt, and you can see where's the key point, where you usually need to put the shunt, where you need to insert the shunt, and you can also see how deep you can go. Do you need 4 centimeters? Do you need 5 or 6 centimeters? So it's very nice. And that's pretty all. We're now moving forward. We'll try more advanced stuff, but for now, I think it's pretty nice.
That looks really amazing, and I'm so glad that we can help the real professionals to improve the approach to the patients. And to sum up the today's live stream, I would like to ask you to pick out the most important points that you consider helping you using virtual reality, and why do you choose Inobitec to help you to create models?
Okay, so like I said in the beginning, it's not enough just seeing the pictures, the MRI or CT. So I was searching for a software that could help transform this imaging in 3D models, just to see them in 3D. Because, like, 3D is now the trend, 3D everywhere. And I tried a lot of softwares. The most used one, I think, was Slicer. I tried Radiant at that time, was just getting born. Osirix was, yes, also tried Osirix, but this was very, very rough. It's not what I wanted. It just made a general model based on the intensity table. So it's not doing segmentation. You don't have an manipulation to do or to segment what you really wanted. It was very raw, very, yeah. So after that, I found Inobitec, and why I liked it, because it was very intuitive. You can do same with Slicer, for example. It's open source, but it takes a lot of time. I just challenge my colleagues. Okay, I'll do this in, for example, this patient, I'll do it in Inobitec. You'll do it in Slicer. But before that training, some of my colleagues, they quit right in the training. So they said it's too hard to even open up a DICOM in Slicer. So some of them just couldn't open a DICOM in Slicer. Other ones just couldn't find how to segment manually. They just some of them couldn't put the 3D model. They segmented something, but they could see the 3D model. So it's it's a learning curve that you need some months to be good at it. And despite that, you need at least to make a complex model, for example, like that AVM. At the beginning, you need around, in Slicer, you would need around maybe 5 hours. And after you picked up and you learned how to do it, maybe it's enough, like 30 minutes, maybe 1 hour to check all the details. And Inobitec helped me to go from 2 hours of segmentation. In a few days, I was like in 5-10 minutes, I could do three structures to segment like in 5-10 minutes. It's easy. I already showed how, for example, that tumor, but that tumor is one of most complex. Usually it's little tumors inside the brain or brain stems, or that you can easily differentiate, and that you can almost in 1-2 minutes even. And I gave some of my friends, and they did this in a few days when they already learned how to segment it, and I was impressed. They didn't know how to open DICOM in Slicer, but they already made 3D models in Inobitec.
I would also like to comment that despite all the automatic tools, the software is not like a magic tool, and you still need to follow some screening protocols and make sure that you have proper studies for this or that type of segmentation, because we do not use any AI, we do not use any cloud service. It is just the desktop application which which works based on pure mathematical algorithms. And to segment vessels, of course you will need the contrasted study. And if you need to see the DTI fiber tracks, you need to have the entire DTI series, as Alex already mentioned. I have a question in the chat about the MRI DTI. How many directions MRI DTI do you use for fiber track?
How many directions? To be honest, I don't know how to answer that questions.
Hi Marcel, can you please just rephrase your question, because it seems to be really interesting, but
yeah,
we
but
need to have more details.
If I'm not wrong, it takes all the directions of the fibers, so that's why you have that colors, that you can see not only ascending or descending tracks. You have all little fibers that are around. If I'm not wrong, maybe I'm not wrong, and maybe the question I didn't understand the question. But as far as I know, it takes all the directions, because it's the raw set of DTI, and you can pick up what you need.
We got a question: is your company based in Russia? Yeah, we're the head office is in Voronezh. It's 500 kilometers to the south of Moscow, from the capital. And yeah, we're based. We're currently based in Russia, but still we are cooperating with worldwide with the medical specialists all around the world, and Inobitec is popular among bioengineers, radiologists, surgeons from Bolivia to Japan. So we're covered almost all the entire world. You can track our social network, Instagram or LinkedIn or Facebook page, and you can see how we cover country by country every month we have a user, we have a new user in different countries, and we are proud to invest in the development of healthcare from the point of view of innovations, and we are so pleased to help people who are on the front line, who are make complex surgeries, and we are glad to be the perfect tool for them. Okay, thank you, Alex. You've been a great presenter, and I think that many people will start applying new technologies in their lives, in their work, and because all of these technologies they become available day by day, and the softwares become cheaper, the headsets and all the equipment every month become more available to the wide audience, I would say. So I'm sure that pretty soon these technologies will be applied officially in the hospitals, and they will help surgeons worldwide.
Yeah. So.
Yeah.
No, I just want to. Meanwhile, I just search for the plugin. I just want to share. So this is the plugin that is used.
Marui plugin.
So if you have Inobitec and you have Blender and you have this plugin, you're good to do brain surgery.
You need to have medical education.
Oh yeah, I forgot about that.
What is the AR app used on the iPhone that was shown before?
It's a Reality Composer.
Reality Composer.
Yeah, it's the. Okay. I think it's their app, the Apple's app.
Okay. So I think that's enough for today, and we will definitely meet again. Thanks a lot, Alex. I think that session was great. We will, for sure, we will make a recording of it, and for those people who didn't have time to attend the live stream, they will find this recording in our social media. So please follow us on social media, and check our website. We have the program trial on the website. We have prices on the website. We can cooperate. We are searching for the dealers worldwide. So join us, and we will be glad to cooperate with anyone we need. Thank you very much, and have a nice day. Thanks for attending the live stream. See you soon. Bye-bye.